As the number of new daily infections continues on a downward trajectory, the re-evaluation of the current COVID-19 movement restrictions is on the table. On Thursday, the Health Ministry reported nearly 4,000 new cases. The answer of whether the country will be moving down to level 2 is yet to be answered.
We're discussing it with the NCCC. The NCCC will give us, Coronavirus Council will give us a guide on that. And I'm sure when the President speaks, whenever he does to give us guidance, that question will be well answered. Right now, a lot of consultations are going on, and certainly with the numbers that are moving, there are certain adjustments that we need to look at. So President will be able to give us a full guide at that point when that decision is made. No decision has been made yet about level 2.
Mkhize has thanked the Cuban Medical Brigade, describing their input in fighting the spread of the infectious virus as formidable. The teams in the different provinces will continue working in communities indefinitely. The minister says the presence of the Caribbean health workers is dependent on the management of the pandemic.
It is fair to presume that as long as we have COVID-19, we will need support. It is also fair to say we will be open to looking at the work we do with Cuban doctors to see whether there are other areas where we might be needing them to assist and reinforce us. The main issue, our primary health care approach, our community health side, does need a lot of transforming, needs a lot of reinforcement.
Meanwhile, the World Health Organization's search team has completed its quarantine and will begin its work in the country. The 17 experts landed in South Africa earlier this month to assist in bringing down the infection rates. Another 26 medical workers are expected to join the search team in the upcoming weeks.
This search team from WHO is a mobilization of experts mainly from the regional office and the African region, and from WHO headquarters in Geneva, in collaboration with our country office. We are supplementing WHO's technical assistance in several hard-hit countries in the region that have approached us for support by increasing the number of experts on the ground who will be integrated in the national response.
The Ministry of Health and its partners have shown great commitment and diligence in their efforts to curbing the spread of COVID-19, and we hope that these experts' full mission to the Ministry of Health, the visiting and virtually deployed experts, and to all our partners, by working together in solidarity, we can bring this pandemic under control.
And while the surge seems to have taken a dip, the minister says the team will bring a set of fresh eyes which can identify weak spots in the current response methods.
Those that are already here with us have begun their orientation to ensure that there is optimal alignment and programs. The work of battling the pandemic does not begin and end, and therefore we will be encouraging agility, and we welcome the fact that they will be looking at our situation with fresh eyes and may be able to identify blind spots or offer perspectives we might not have considered.
Mkhize says they're working to ensure that once the number of new infections is steadily in the lower numbers, a resurgence doesn't happen like it has in the United States and parts of Europe. Nomapolani, SABC News.